If you are living with HIV, it is still possible to have sex without putting your partner at risk. The precautions you need to take depend on factors such as whether you are taking medication for HIV and if either you or your partner have recently had unprotected sex with someone who may have HIV. It's important to learn how to have safe sex in order to protect yourself and your partners. Antiretroviral therapy, also known as ART, is a type of medication that helps to stop HIV from causing harm to your immune system. These medications work by reducing the amount of HIV in your body. It's important to note that it may take up to 6 months for ART to begin effectively working. In some cases, ART can be so effective that HIV cannot be detected in your blood, which is referred to as an undetectable viral load. This means that you cannot transmit HIV to others through sexual activity. However, it may still take up to 6 months for ART to lower your viral load enough to make unprotected sex safe. It's also important to remember that even if you are HIV positive, you can still become infected with a different strain of the virus. Therefore, it's essential to protect yourself if you are unsure of your partner's HIV status. If you are using ART, it's necessary to have regular blood tests every 3 to 4 months to monitor your viral load. It's important to keep in mind that some individuals may never reach undetectable viral levels despite being on ART. When it comes to safe sex, using condoms can greatly reduce the risk of passing on or catching HIV. The level of protection varies depending on the type of sexual activity. For instance, anal sex carries the highest risk of HIV transmission, with a 1 in 72 chance of infection without a condom. However, using a male condom reduces this risk by 72%, to 1 in 259. If you are the person on top during anal sex, the risk of getting HIV from your partner without a condom is 1 in 909. For females engaging in unprotected vaginal sex with an HIV-positive partner, the risk is slightly lower at 1 in 1,234, but using a condom reduces this risk by an average of 80%. It's important to note that oral sex poses little to no risk of HIV transmission, and using a condom during oral sex can further reduce this risk. Lastly, it's essential to remember that without condoms, there is still a risk of catching other sexually transmitted diseases such as gonorrhea and chlamydia. Pre-exposure prophylaxis, PrEP, is a preventive drug that can help stop HIV from infecting your body if you are at high risk of getting it from your partner. If you take PrEP every day as directed, your chances of getting HIV can be reduced by 99%, but it takes at least 7 days for PrEP to start working. Post-exposure prophylaxis, PEP, is an emergency form of treatment that you can take if you have recently had sex that may have exposed you to HIV. It is important to take PEP as soon as possible, and no later than within 72 hours of having sex, otherwise the drugs may not be effective.